In today's world, I believe it's important for health system leaders to understand total cost because we're making a migration and transition from fee-for-service to fee-for-value. We need to understand that total cost of ownership for all products and product activity. To give you an example of what I mean, I was at one of our distribution centers recently, and I noticed an individual battery sitting on the shelf. And as I inquired, I found out that we ship that hospital system individual batteries. When I started to look at the cost of the individual battery, the cost to move the product, the cost of transportation, of handling, of extra warehousing, all the way up to the storeroom where the nurses pulled the batteries, realized that the cost, that total cost of ownership was 5-6x the individual cost of the battery. And as I inquired and pushed further, what I understood was the individual buying the battery, they were responsible for the unit cost only, not for all the other costs associated with moving the battery through the supply chain. If I was in the health systems or if I was a CFO of a health system, some of the questions I'd be asking, one is, do I understand total cost of ownership? If I do, who's accountable for it? Is it me or is it somebody else down my organization? Second, have I aligned decision rights with accountabilities? So back to the battery example, is that individual measured on total cost of the battery and total cost ownership, or is that individual only measured on the cost or unit cost of procuring the battery? And then third, do I understand the cost levers and activities that are driving costs within my system?